So, again, so nobody stepped up. What's wrong with the government stepping up? At least they're willing to come and to tackle this great big issue. What do you say?
Well, when the government gets involved, invariably you're going to have fewer choices. And, it's sort of like the new version of the Golden Rule. We know what the old version of the Golden Rule is, something we all want to live and abide by, but the new version of the Golden Rule is he who has a goal makes the rules. So if the government gets involved in the business of health care, they're going to set the rules. And they're not going to set the rules as if you and your doctor were setting the rules about what was good for you. They're going to set the rules as to what they want economically. It's going to be driven incredibly by economics, but it's also going to be driven by their worldview of the bureaucrats or the panel of bureaucrats that are going to be making these decisions about whether we're going to have life-honoring decisions or not. That is the real concern here, is that when you turn over the decision-making about your health care, your parents, your children, to people who are removed from you, removed from your value system, you're going to ultimately be bound by decisions that you're not going to be happy with.
And Rita, that's where you've become involved. You've been watching euthanasia and assisted suicide for decades now, and now, well, it's coming on us full force. Tell us where it weighs in with the health care plan that the government wants, and how that brings a concern for assisted suicide or euthanasia from your group.
Sure. Well, if you have had a chance to read any of H.R. 3200, which I think more people who are not elected officials than those who are have read it, you'll find that in there is this advanced care planning consultation. And a practitioner, which is either a nurse practitioner or a physician's assistant or the physician, is supposed to talk to people about their end-of-life options. Now, that sounds relatively innocuous to people who aren't familiar with the buzzwords about end-of-life options. But this practitioner is supposed to explain the continuum of end-of-life services. If one happens to live in Oregon and Washington, for example, that will require physicians and or whoever happens to be the practitioner to also be including in their counseling or consultation, letting the patients know about the availability of assisted suicide. If your doctor happens to suggest this as an option, something to consider, something that is certainly a medical treatment in Oregon or Washington and perhaps in Montana, depending on how the court case there goes, you're going to have everybody subjected to this. We're not talking just about people who are terminally ill, but everybody who is on, for example, Medicare or Medicaid.
You got into medicine to save lives, not to take them, and now this thing would force you to do it, or force you to what? Go to jail?
Well, probably that won't be the result, but there will be another serious result that will concern all Americans. And we did a survey. 55% of physicians in this country understand that there's a personal God who is involved in their lives on a daily basis. When we do surveys, over half the doctors out there understand a very personal God. So they're faith-based doctors. Well, when we survey faith-based doctors and say, what would be your response if you're forced to do an abortion in order to keep your job or to be accepted into the system? And 95% of them said, we'll leave medicine. 95%. Now, think of the impact of that many doctors leaving health care and what access problem that will cause. That's a concern for every American, not just for faith-based doctors who might lose their job and have to look for something else to do.
Well, I just want to interject. I don't know that there's some that, what about that 5%? They may say, I really want to practice medicine, but I'm not going to do these abortions. Then they may be in the position that Senator Tom Coburn said. He said, before I do an abortion, and he said, rather than leave medicine and do something else, he said, before I do an abortion, I will go to prison.
Yeah.
And I think that this might just very well, look, if there's fines, if there's penalties, and you don't pay those, if you don't get out of the practice of medicine, you will be looking at jail time, will you not?
Oh, absolutely. There will be some type of punishment, either loss of job, loss of position, loss of advancement, or civil penalties or criminal penalties. We don't know what the ultimate limit of this is, but there's going to be some punitive action against doctors of conscience, doctors of faith, who resist participation in abortion. Even the process of referring, medical referral of abortion is not just saying, well, look in the phone book. when a medical referral is an endorsement of what the patient wants, it's the best option for her, and I'm sending you to someone qualified to do it, and I'm endorsing this. That's why we resist not only not doing abortions, but we resist the process of referring for abortion, because it's being complicit in an immoral act. And a lot of people don't understand moral complicity, but that is clear complicity when you say, I'm facilitating through medical referral for an abortion.
You just came back from testifying before the Republicans in Congress, Republican Roy Blunt, John Boehner, Eric Cantor. We want to just hear what you had to say and how they received what you had to say. You had the insight that they were looking for. Just what was it that you told them?
Well, as I mentioned, Michael Moore would have folks believe that this is a healthcare paradise. The reverse is true. I told them some horror stories about previous clients of ours who fell through the cracks in our Canadian socialized system. And please understand that everything about healthcare in Canada is not bad. We have a perfectly good primary health care system. That's family doctors. We're good at emergency care. It's the elective surgeries that we're talking about. And when I'm saying elective surgeries, Janet, I'm not talking about a tummy tuck or a facelift. I'm talking about malignant brain tumors. I'm talking about people with blocked arteries who have a week to live. Those are categorized as elective surgeries. And as such, you go to the end of a long line to wait in turn, and it's shocking.
Yeah, I think they ought to rename that. That's not an elective surgery if it's one that saves your life. I mean, that's life-saving treatment, is it not?
It is life-saving treatment, but by calling it elective, they feel justified in making people wait. If it was life-saving and they still made people wait, how backward would that be?
When the Republicans in the House Ways and Means Committee tried to issue a detailed chart of what this new healthcare system would be like, guess what? They're told you're not allowed to send it out to your constituents. The Franking Commission says, hey, your mail isn't deemed acceptable to be sent. And what this did, it was basically had all the charts with the government agencies, the boards, the committees, the IRS, showing the bureaucratic nightmare that would be the American healthcare system, but they're not allowed to know it. By the way, we will have that chart posted at f2a.org for you to see. But it really just seems like it's pushing a whole lot of people off the ledge. It brings with it death. What do you say, Rick?
Well, absolutely. And I made the comment to your congressman that I've told many people that as they sit down to craft the laws that will affect the lives of Americans, they should know that the act in Canada that governs the delivery of health care is called the Canada Health Act. And I said that act has been responsible for more pain, suffering, and death, yes, death, than any other act in domestic Canadian history.
Well said. Keep that in mind when you're making those calls to your members in Congress. 202-224-3121 is the number, by the way.